my name's Maddie. I'm going to be your nurse today, and I checked in your orders that we are going to do some trach care, so we're going to change that inner cannula for you and change the dressing as well as your trach collar. Do you have any questions for me?
Nope.
Can you state your name and your date of birth for me?
Samuel Jones, 1/2/1990.
And do you have any allergies that I should know about?
No.
Okay. So I'm going to go get all my supplies, and then I will come back in to start. So I'd perform hand hygiene. I would provide patient privacy and close the door. And I put on some gloves. I would raise the bed to a working height and put the patient in semi-Fowlers. Mr. Jones, are you in any pain today?
No.
Okay, if they were in pain, then we would give them some pain medications for that. I'm going to put on a mask as well, just to make sure we keep no pathogens coming to the patient. Okay, so first, this doesn't need to be sterile because I'm getting rid of the gauze, so I'd take off the oxygen. And this is, remove this. And I would look at it for any drainage, smell, odor, anything like that, and I would document that. I don't see anything, so just dispose of that. Make sure you put the oxygen back on. And then I'm also going to remove the inner cannula, and you want to put a hand underneath the border so you're not putting pressure on the patient. Just twist to unlock. Pull that out. Put the oxygen back on. And then you're going to need sterile gloves for this next part. So first I'm just going to open my sterile equipment, and the inner cannula is also sterile. Put on some sterile gloves. So now I can touch anything in here. And so I'd open up my water. And sometimes they have it so you can dump it in there, so I do that. And then one of my hands, my non-dominant hand, is not going to be sterile. So I'm going to replace the inner cannula first. And usually you'd use this one, but that one doesn't fit, so we're just going to use this one and pretend like it's the new sterile one. So with my non-dominant hand, I'll take off the oxygen, so now this hand isn't sterile. Hold it there, like we did earlier, and put that in. Twist and lock. And then put the oxygen back on with my non-dominant hand. And then we're going to use Q-tip in the water to clean around the area underneath. And you're going to be checking for any signs of infection, redness, swelling, itching. And you document that too. Dispose of that. Then we're going to put a new gauze on. This is the old one, but there's not one that's cut in there, so we're just going to pretend like this is the one that I got out of there. And then you want to make sure that you're not touching the edges of that's going to go around the stoma. So take off the oxygen. How you doing, Mr. Jones?
Good.
And put the oxygen back on. And then I'm going to put on new gloves for this next part. And you're going to need another nurse to come hold the cannula while you change the trach collar. And usually these collars come in a little bag, but it's not sterile, so get that. And then you have another nurse come, take off the oxygen, and they're just going to be holding it right here for you so it's stable. And take this one off. And you can dispose of the old one. And you want it to fit so that you can just fit a finger underneath it so it's not too tight, but it's also not too loose, so it's holding that in place. Replace your oxygen, and then you can dispose of all your equipment, and then I would assess the patient's respiratory status, so their O2, their respirations. I'd listen to them as well, make sure they're doing okay before you leave. And then I'd lower the bed and make sure the call light is next to the patient, make sure they're comfortable. And then I would go document the assessment findings, procedure, date, time, and I would also make sure I do hand hygiene on my way out.